The rubella virus belongs to Togaviridae family. It is an enveloped and single-stranded RNA containing virus. The rubella virus belongs to the family Togaviridae. It is an enveloped and single-stranded RNA containing virus. The shape is pleomorphic and roughly spherical. This is the structure of rubella virus. The rubella virus causes rubella, which is also called as German measles. It is a mild exanthematous fever, that is, it has skin involvement with maculopapular rash and lymphadenopathy. The rubella, there is mild exanthematous fever with maculopapular rash and lymphadenopathy. The rubella is usually trivial, that is, it is not very severe and hence it is of less importance. But in case of pregnant females, the rubella virus can lead to congenital rubella syndrome in the baby. The congenital rubella syndrome is made of a triad which consists of cataract, deafness and cardiac defects like PDA, that is patent ductus arteriosus. So the triad of congenital rubella syndrome is cataract, deafness and cardiac defects like patent ductus arteriosus. The cultivation and host range of rubella virus. The rubella virus is grown in many primary cell cultures and also in continuous cell lines like rabbit kidney cell line RK13 and Vero cell line. But the cytopathic effects are produced only in few cell lines like RK13. So, for the growth detection in others, we use interference method using Echo 11 virus. So, in other cell lines, growth detection is by interference using Echo 11 virus. Coming to the clinical features. The incubation period of rubella virus is 2 to 3 weeks. The infection occurs by inhalation. So firstly, there is generalized rash on the face, which then spreads to the neck, trunk and extremities, sparing the palms and soles. And the rash is discrete and it disappears on the third day. So the clinical course is, firstly there is generalized rash on the face, which then spreads to neck, trunk and extremities, sparing palms and soles. The rash is discrete and it disappears on the third day. And also there is non-tender enlargement of the posterior cervical glands. Rubella is most common in children. Sometimes it can produce complications. The complications include arthralgia and arthritis. This is most common in female with increasing age. So the complications of rubella are arthralgia and arthritis. Now let's see about the congenital rubella. In case of very early pregnancy, the infection with rubella virus can lead to abortion. In case of first trimester, there is up to 90% risk of occurrence of congenital malformations in the baby. In the second and third trimester, the infection leads to communication defects or developmental retardation. But this may not be apparent till the child grows older. In very early pregnancy, the infection leads to abortion. In first trimester, there is up to 90% risk of congenital malformations. Second and third trimester, the infection leads to communication defects or developmental retardation in the baby. Expanded rubella syndrome. In some cases, expanded rubella syndrome is seen, in which there is features of congenital rubella along with some other features. So features of congenital rubella are cataract, deafness and cardiac defects. We have seen this already. And the additional features include hepatosplenomegaly, thrombocytopenic purpura, myocarditis and bone lesions. These are the extra features, and this syndrome is called expanded rubella syndrome. Lab diagnosis of rubella. The lab diagnosis is important when rubella is suspected in pregnant females. The lab diagnosis in pregnancy. It is done by serological methods or virus isolation. First, serology. ELISA is performed. Enzyme-linked immunosorbent assay. This is performed to detect immunoglobulin M and immunoglobulin G antibodies. If only immunoglobulin M is present and immunoglobulin G is absent, this indicates there is current acute infection. Whereas if only IgG is present and IgM is absent, this indicates past infection or vaccination status. The next, a screening test is performed for pregnant women by TORCH panel. TORCH stands for the infections, T for toxoplasmosis, O for others, R for rubella, C for cytomegalovirus and H for herpes. So, pregnant women are screened for TORCH infections. The next method is viral isolation. Isolation is performed from blood during the early stage of the disease and from the throat swabs in rabbit kidney or Vero cell cultures. Next, in case of congenital rubella, lab diagnosis by serology includes detection of IgM antibodies, immunoglobulin M antibodies in the newborn. If IgM antibodies are present in newborn, it indicates intrauterine infection. IgM antibodies are tested because they do not cross placenta, whereas IgG antibodies are transplacental. Next, isolation. Isolation is done from urine, throat swabs, white blood cells, bone marrow or cerebrospinal fluid. Epidemiology. Rubella is worldwide in distribution. About 80 to 90% are immune by 15 years of age. 10 to 20% of mothers are non-immune and therefore they are vulnerable to develop rubella. Lastly, the prophylaxis of rubella. The rubella infection provides long-lasting immunity. The prophylaxis mainly includes vaccine. Vaccine is live attenuated vaccine with RA27-3 strain, which is grown in human diploid cell culture to produce the live attenuated vaccine. The strain used is RA27-3 strain. The vaccine is given alone as subcutaneous injection or it is given in combination with measles and mumps as MMR vaccine, measles, mumps and rubella vaccine. The contraindications of vaccine. The live attenuated vaccine is contraindicated in immunocompromised and immunodeficient patients, and pregnancy is an absolute contraindication, and the pregnancy should be avoided for 3 months after vaccination as it may lead to teratogenic effects. This is about rubella. Thank you.